Hi, everybody. This is Professor Miller. Just wanted to check in and give you some more information in regards to the upcoming week. I did have some responses for the survey in regards to a WebEx session that we can hold, and it looks like it's leaning towards Tuesday. And I don't know if you guys have stuff going on Thursday, so most likely would be on Tuesday evening at 7:30. I will put a post up to officially set the time and date, but it does look like it'll be Tuesday. So for right now, I just wanted to give you a little bit more information in regards to Module 1, just so that you're not lost and feeling like there's an overabundance of information here. I just wanted to kind of go through things real quick in case you are getting started with the information. For the first week, Module 1, that was from January 4th to the 8th. It's basically just getting introduced to the course, kind of getting an understanding as to how the course runs, and then I did put some websites up here. This is strictly for your own information, and it's just to kind of help guide you for information that you are looking for. So like the Kaiser Family Foundation, they have a lot of good health statistics and data. Same thing with HHS. There's a multitude of areas that you can look up on HHS, but there is good links for healthcare reform in the ACA with good data and all that. Council of State Governments, too. This is another website that you can look up, and it gives you some information about our state government system. Congress.gov, it's a little bit more broader. And then, obviously, there's the Michigan Legislator site as well. And that looks more, obviously, at our own, within the state of Michigan. So these are all just meant for resources. It's not like it's necessarily like you have to spend hours looking on it. It's just good areas to go to if you are looking for certain answers. The NGA paper, this was another PDF file that I put up here, and it's more about the role of NPs, because it does look like we have all NP students in our class, which is great, so we can kind of concentrate on the role of NPs for the semester. We will talk about other roles as well, but it's kind of nice because we can kind of gear it towards our practice. So this essentially is talking about NPs meeting the demand for primary care and how we can help transform healthcare with access of care, quality of care, etc. That's my main overall goal for you for this module, is to get an understanding of healthcare transformation, like where the United States healthcare system has, like with our data in health population, how have we been, what's our statistics, has it improved with the ACA? Just looking at factors like that and how our role as NPs kind of fit into that arena. So the first module essentially is just kind of getting you introduced to that. So same thing with all these, these files that I have up. I don't expect you to sit there and study these and read them for hours. A lot of them are meant for resources. Some of these are just PDF files that are different publications. And if you look up here, like for the course material, I will typically always put like Module 1, your readings, assignments. Let me click on that. And it's kind of usually like I'll give you an introduction into the course module, the topics that I want you to kind of focus on. So, introducing APRN political advocacy, introduction to the healthcare transformation, and then looking at federal and state health policy, and then also looking at the health policy with populations and access to care. So this is just I feel like the first module is just to get you orientated to what we have going, essentially. And then our Module 1 readings, which are the ones out of the textbooks, are always listed here. And then I will always have assignments posted, and this obviously is just for the first one. You have your introduction form that we already have going, and then we will have the initial form post that's due by the 14th at midnight, essentially, and then we'll have time for second postings, and I usually will do like a 5-day period after that for your follow-up postings. Now, I did put this up here with HB 5400, and that's the new bill that affects our practice. And I just put this up here because I wanted to give you an example of it moving through the system, just so you have a good understanding as to how these bills take place. Like, how does it move through the system? I just want you to have an understanding of that, because if you are to write a letter or if you were to contact a legislator, you have to know who to contact. And you have to figure out where the bill is, like where is it at the current time. Sometimes if you were to look up a bill, you'll just see that it's introduced at the House. And, these will all be blank because they haven't even moved through the Senate, etc. This one is obviously it's already made it through. It's right now, currently, it's still in the process of getting signed by the governor. And I believe they have 14 days to sign it, so that should be occurring within the next week or two. So this was a huge bill for our practice. Obviously, we still have a little bit of ways to go with this, and we'll talk about the health policy and our APRN role in Module 2. We'll kind of go more into that more specifically. Right now, I just want you to get a good understanding as to where we kind of stand with healthcare. So the other one I gave too is an example of a health-specific bill in Michigan. So I want you to get an understanding as to bills that affect within the state, and then having an idea of how bills affect at the federal level, because it's two separate things, and you have to kind of know where you're targeting, whether it's a state issue or a federal issue. So that's kind of what I want you to understand with this first module. This is just a thought-provoking article I put about Henry Ford Hospital. This is another thing too, and actually we have a clinical rotation through Henry Ford, and I've been the clinical faculty for it, and it's a transitional care program. You'll see this a whole lot more with NPs, and it's essentially transitioning patients from the hospital setting to the home or back to assisted living or etc., and making sure that their care is followed through and to reduce readmission rates. So that's another huge thing, because if you read through some of these articles, you'll see that with the ACA, hospitals are actually penalized for the amount of readmissions that they get. It's a pretty complicated process with all this, and there's so much information. I want you just to get a good taste of what is out there right now. Introduction to the U.S. healthcare system and APRNs. Just giving an idea as to how we fit into shaping health policy and why it's so important to it, or to this. In this article too, there is actually a good portion of it talks about APRN advocacy and actually like writing a one-pager and writing your legislator. So this is it gives you a good idea as to how that process occurs too. APR integration and improving care and the policy paper. This is a long paper. I don't expect you to read this, and study it. It's more of a resource for you because it's by the Federal Trade Commission, and it supports our practice. So a lot of this stuff is just a resource, essentially. And then this is a great PowerPoint. It's from the Kaiser Foundation, and it looks at the statistics and the data of the healthcare system in the U.S. So it gives you a great idea as to where we stand compared globally. So take a look at this one. You'll get a good understanding of the areas that we definitely need to be working on. Intro to the legislative process. This one is basically about legislative communication. And within these two books, there are two videos that you can go ahead and watch. These are just for your own FYI information, how a bill becomes a law, and the basics of reading a bill, just to give you an idea if you were to look up a bill as to how to read it, what the information means, and all that. Same thing with Citizens Guide to State Government. This is a long document, obviously, too, and I don't expect you to sit there and study it, but it's a good source to go to if you are not understanding a process of the legislative arena, and it gives you a good idea as to how our state legislature works. Another area, too, that I want you to essentially get out of Module 1 is population and health disparities. So looking at disparities in care and the coverage gaps that we have. And a lot of our practice as nurse practitioners can help fit this need. So I just want you to be able to link the two together. That's what I kind of want you to get out of this, and how we can improve the disparities in healthcare. Because you'll see a lot of times too, nurse practitioners are working pretty much independently with a collaborative physician in rural healthcare areas, and we can fit that need. There's a lot of populations out there that don't even have access to care, so that's an area that I want you to kind of take a look at as well. Examples of state and federal health policy. This is, like I mentioned, understanding what is a state issue, what is a federal issue. If you're looking at Medicare, Medicaid, it does have a federal issue. It's a federal, run program, but it also is affected by the state as well. Each state institutes their own rules and regulations with how they kind of want to go about the federal issue. So getting an idea as to what's a state issue and a federal issue is kind of my whole purpose with this part of the module. Like the HB 5400, that's a state issue with our practice. And we'll look at more of our role within the module, the second module, and the implications for advanced practice nursing. Right now, I just want you to get that understanding, like I said, of state and federal. Federal ruling, like I said, this is a federal issue, veterans' access to care. So this was a ruling that was proposed at the federal level. So this affects, APRNs across the nation. So you can see the difference between this being federal and this being a state issue. Michigan healthcare, I just want you to have a good understanding as to where we stand specifically within the ACA and healthcare transformation. How are we doing? Michigan Blueprint for Health, it kind of gives you an idea of our goals for that. It's a long document, so it's something you can just kind of scan through. And then this is another little PDF file that talks about Michigan nurse practitioners and data with APRNs. The Michigan Healthcare Exchange is the ACA exchange website. That's where people can access the healthcare if they want to sign up for it through the ACA. Just take a look at that. Just become familiar with it. And then I also put some more general resources. This is a legal guide for older adults. Those of you that are going into adult gero, this is something that you could use for a resource later for your patients. It's obviously geared towards the patient and written for the patient, but it's a good resource if your patient has questions, and it's something that they can take a look at. It's for older adults. The state legislators guide, this gives you more information as to our state, senators, etc. It's kind of similar to the citizens guide up here for state government, but it's just something you can take a look at. And then we'll take a look at Module 1, Discussion Forum. So discussion 1, this is, I have it open just so you can see the questions. That way when you're reading, you can kind of help answer these questions when you're going through it. So in your opinion, what are some of the key forces driving health policy and healthcare transformation in the U.S.? So just looking at what you feel are the main issues with healthcare transformation. What are our goals? And how does our practice as an APRN or nurse practitioner fit in with this? How can we meet these goals? Number 2, barriers at the state level can at times impede upon the success of federal health policy initiatives and the overall improvement of population health. So like I said, there's laws that are instituted at the federal level, but then the state sometimes doesn't necessarily fully enact them. And it could be even with our practice as an APRN, or it can be a health-specific policy. Like if you look at Medicaid, our U.S., one of the goals of our healthcare transformation is expanding state Medicaid. Not all states have Medicaid expansion, and you'll kind of note that as you look through some of the information that I posted within Module 1. How can APRNs make a difference in the health of their patients and public through active engagement in health policy? And you can, with this question, you can go as specific as you want or as broad as you want, or you can give examples. I just kind of want you to get you thinking as to how we fit in with this healthcare transformation that's occurring. And with President-elect Trump coming in, things could be, much different coming up, and we'll kind of have to wait and see what occurs here. But we definitely, as APRNs, need to be supporting the transformation and making sure that our populations do have access to care and health care. So that's this semester will be rather interesting with everything going on, which I think it'll be good, and I think it'll make a good semester. And then number 4, to effectively engage in state and federal health policy issues, you need to be aware of your elected officials. So essentially all I'm asking you to do with this question is to identify and list your state senator for your district, your state representative, and then who's our U.S. representative for the state of Michigan. So there's just basically the 3 individuals that you should be looking at. If you go to the Michigan Nurses Association under like the advocacy policy, I think it's under that one, it'll literally give the answer to this question. I just want you to be aware as to who it is, what their interests are, do they have any health-specific background policies. For instance, I know I looked in one of them, I think it was in my district, one of our state senator, or a state representative, it was my district senator, was a previous EMT. So obviously they have a good understanding about healthcare, or they should have a little bit of understanding, where some don't have any background in healthcare. So that's important to kind of know too, because it's our job to educate state legislators about healthcare issues. Otherwise, it's never brought up and they don't know the importance of it. So if they don't have a background in healthcare or have any knowledge about it, It's our job to kind of take that place and, go in and talk to them. So that was all I'm really asking with question 4. So I just wanted to give you an overview and not make you feel overwhelmed with all this information I have up here. It's just basically a lot of them are resources. A lot of them are just to stimulate your thinking on this. Um, and I mainly want you to focus on understanding healthcare transformation for this first portion. We'll talk more specifically in Module 2 about, the federal healthcare system, the ACA. We'll go into more specifics about our healthcare system and our APRN practice in the second module. So, don't be concerned that we're not going to cover any of that. We'll cover that in the second module a little bit more specifically. Right now, I just want you to get a good understanding of where we stand, our APRN practice, what's state and federal, how a bill becomes a law, and then, some of the healthcare disparities that are out there. So just basically our first module is kind of getting orientated and working towards that goal. If you do have any questions, do not hesitate emailing me, posting any questions. Actually, I will put up a student forum actually on here. I forgot to do that. That way, if you have any questions or you want to bounce information off each other, I'll put a forum up there too. And I'll check in there to see if I can answer any questions. So for right now, I think it looks like we will be meeting on Tuesday, and that will be to go over more of the assignments that we have for the rest of the semester and answer any other questions that you may have. So I look forward to talking to you all, and if you have any questions, do not hesitate to ask. Thank you. Have a great day.